file in just a minute here, and I'll just make sure that we have everything complete, okay? So when we first bring a new client in, and you've never had electrolysis before, right?
Correct.
Perfect. We like to talk to you from start to finish about what the process is and what you're gonna expect, what you can expect from us. You know, you could commit to electrolysis and it has very, very, very good results. And I'll walk you through after we look at your hair and your skin, what I think or we think is gonna work best for you, okay? So basically, when we do electrolysis, there is a tiny little probe that after I examine your skin and your hair and figure out what we think is gonna work best for you as far as our modalities and what we're gonna use for power, tiny little probe goes right into the hair follicle. It doesn't pierce the skin, it's a natural opening in the skin. And we either give it a little bit of direct current, which is heat, or we do a little bit of, alternating current, which is heat, or we can also do a different one that gives us a little bit of a chemical reaction that ultimately both of them do the same thing. They kill the cells inside the hair follicle so that that hair doesn't ever grow back. There's other hair reduction methods out there, obviously, that like laser, for example. It's good for some people. It's not good for other people because of their color, maybe the color of their hair, the texture of their skin. But electrolysis is okay for any skin color, any hair color. It works because we directly target that one pore, okay? Now that being said, it does take a little bit of time. It's progressive permanent hair removal. But once we get it, it's gone, okay? If we stick to the plan and make sure that we follow the schedule that we give you after we talk about what we think, how long it's gonna take for us to work on your hair, okay? Now there's 3 hair growth cycles. And without getting too complicated, the newest hair growth is anagen hair, okay? And that's pretty much baby, brand new hair. This is the phase that we wanna get your hair in, okay? Because this is the phase that has the most cells in the papilla, which is the bottom, and also in the bulge area. It's actively growing, it's a young hair. So if we can catch it in this anagen phase, there's a pretty good chance that it might be the only time that we have to do that specific follicle. Now with the catagen, that's the second transitional phase. It starts to detach from your follicle, from the papilla, and then start to come out, like you know how your hair naturally falls out. Every part of your body, that growth cycle is going to be different as far as time is concerned. The hair on your head has a really long growth catagen cycle because it stays on your hair a really long time. Some of the hormonal areas are shorter. That hormonal area meaning your face, chin, anything that's kind of in the middle of your body, pubis area, and underarms. Those are a little bit tougher hairs. So, and those are usually the ones that people want to get rid of, right? So those take a little bit more. And then telogen hair is basically old hair. And at this point, it's really close to the top of your skin. It has just a little tiny ball underneath your skin that it's holding onto, and it's not growing anymore, okay? And then anagen starts again. Now, when we remove hair from you in a week or 2 weeks, you might see new hair coming up after we've removed the hair. But what that is, it's another growth cycle. It's actually, when I'm looking at you, I can pretty much see underneath your skin that you have some new hairs underneath there that are getting ready to come out. Now I can't treat those hairs because they haven't touched the surface yet, okay? So you kind of have to be patient with the process. That's why we call it it's progressive permanent hair removal. You know, depending on what your sensitivity level is, what kind of time you have as far as schedule is concerned, how fast your hair grows, and what your budget is like. That way we kind of design what's best for your hair, and you have to decide if that's going to work good for you, okay? Everybody asks all the time, does it hurt? Does it hurt? I'm sure you want to know, right? My job is to make sure that I can pick the best modality for you and your skin and your hair that's going to remove the hair, kill the cells, but without hurting you or damaging your skin too much. We try to work lower levels first and then progressively move higher to figure out what's going to work best for you. And I'll talk you through that at the beginning a little bit. Now, as your hair gets, as we start treating you and we see you more, your hair cycles are going to change. Your hair is going to get closer to the surface of your skin, and it's going to be different. It'll probably feel different. I have had a lot of electrolysis done to myself. Every part of my body is different. I'm not very sensitive. It doesn't bother me. I've used numbing cream. I haven't used numbing cream on different areas. And honestly, every day is a little bit different. Some days I don't feel anything at all, and then they'll work on the same area the next week, and I'm kind of sensitive. I think it's just your body biology. You know, I try to set you up to tell you what to do before your sessions, so that it doesn't hurt as much. You might find it doesn't hurt at all. Some people can't even feel it. We have clients that don't feel it at all. Everybody's a little bit different, but we'll have a good open communication, so you can tell me like, hey, that's bad. You know what I mean? And I'll try to adjust to make sure that it doesn't hurt you. Okay. So there's a couple different modalities that we can use, and again, they might feel a little bit different. We'll choose what's best for your hair and what works best for your body chemistry. Okay. So that's kind of like the A to Z of electrolysis. Do you have any questions or anything about any of that I covered, or did you find anything different when you were researching?
No, I mean, pretty much it's everything that I've been hearing from people and everything that I've researched online pretty much all lines up. So
yeah.
And
and unfortunately in this circle, there are some electrologists out there that maybe aren't the best at what they do. I'm not saying that that's nothing bad about them. A lot of times people will say, oh my gosh, it hurts so bad. They might be sensitive, but they also might be having work done that's not good for them. You see what I'm saying? So we try to do what's best for you and that doesn't hurt, and work together to find that common ground. Okay?
Perfect.
All right, awesome. So I'm going to go over a little bit of your history. So, no allergies to anything, right?
No, nothing medication-wise, no.
Okay, perfect. And if you could just do me a favor, there's no medication that you're on currently?
Oh, I wasn't sure if it was just asking for the type of medication to cross off, or actually list the ones.
Okay. So. Basically, we're just looking for anything that might interfere with what we're doing to you with the current.
You can write it down.
It looks like none of these will do that to you at all. Antihistamines, nothing like that will hurt you. Okay. So if you could if you don't have any medication right now, just write NA and put your initials next to it. If you want to put the titles on there and just put your initials next to it, I just want to make sure that everybody knows you wrote that, not me. Okay.
No problem.
Okay. And we'll hand this back and forth a few times, I'm sorry.
That's fine.
Okay, no allergies to anything as far as medication's concerned, right? Or any kind of metals, iodine, anything like that, okay. You've never had electrolysis, and then you had, this was probably...
that was puberty.
Yes, that's I was going to say. It's a hormonal time, and that's okay.
But there's been things popping up, ever since then, which of course is normal. So.
That's what happens. Most of our hormonal hair growth comes from our adrenal glands, and you can't stop it. It's hormonal, you know what I mean? And it's going to change throughout your life too. We just want to see if there's anything recent that's coming up. And it looks like 2005 was the last time.
Yeah, nothing really.
Okay, perfect. So go ahead and just initial right here and initial right there for me. Sorry, I'll take that underneath one.
I did just sanitize my hands though.
Perfect,
so.
you're fine. I'm gonna get you all sanitized up. I'll go over what we do as far as our sanitation practices are concerned, just to make you feel more comfortable too. Okay. Temporary methods, razor and tweezer. How often are you doing that?
I shave probably once every few days, and tweezers just kind of like seeing errant hair or something. Just it's not really a part of my grooming process.
Okay. And the areas on your face that you tweeze, is it just anywhere you see something that's crazy?
It's just if I miss something and it's like one hair second, I'll just grab
it. So I'm going to ask you to divorce your tweezers.
That's fine.
And the reason why is because anytime that you're plucking something out or waxing, anything that's going to mechanically pull out the hair is going to cause your body to say, hey, grow another one.
Yeah.
Grow it stronger, right? So if you pluck or tweeze or wax in between time once we start working on you, it's gonna kind of kill the process because it's stimulating that stem cell growth, and that's what we don't want, okay?
Yep.
If you wanna cut, or we can, talk about what areas to shave and what not to shave depending on where we're working at, that's totally fine. It's not gonna hurt anything.
Right.
And then we'll just ask you when you come in, we'll review your file and talk about, hey, what was the last thing that you did as far as hair removal is concerned, so that we know what we're dealing with, okay? But no plucking, okay? That was hard for me. I had to throw all my tweezers away because I had them stuck everywhere, my car, my house.
Oh, no, this would be very easy for me.
Okay. And then no laser, nothing like that ever? Okay.
Correct.
And then permanent methods, you obviously haven't done anything as far as electrolysis is concerned. Okay, so go ahead and just initial next to those 3 methods right there. And if anything ever changes on your file in your return visits, just let us know at the very beginning and we'll update your file for you, okay?
Perfect.
Usually what we do a really quick review and then, just let us know if anything has become different since the last time you were here.
Sounds good.
Okay, so I'm gonna do a really quick skin and hair exam on you, okay? And you can stay here. I'm gonna just put my gloves on to pull up your mask so that I can look, and I'm gonna use my light on you too, okay? Be right back. Okay, before I look at your hair, I'm just gonna show you kind of what my machine looks like and what our sanitation practices are, so that you can see. We're committed to making sure we have a safe and sanitary environment. Everything that we use on you has been sanitized. It's bagged in heat bags. We open up a new one for every client. Everything that we touch you with is brand new, okay? Now, outside of that, everything in our stations, top to bottom, have been sanitized between each client. We take 30 minutes to basically sanitize everything that you can ever come in contact with, or I can come in contact with while I'm working on you, including my chair, my lights, all of that. Our stations are obviously set up with all kinds of sanitizer, so in between time I might stop a few times, sanitize my hands, and I'll let you know, hey, this might be a little bit cold, because especially some people get in the zone, and if I touch you with the sanitizer on, it's cold to them. But everything's brand new, okay? This is basically what we deliver the current with. This cap will be new, and a new probe for every client. I'll show it to you when we get it, because I have to look at your hair first. They're disposable, they get thrown away. We don't use them again. For example, those are probes that are gone and we're never going to use them again, okay? And then same thing with our gauze. Anything that are pillows, everything is sanitized right now, okay?
Perfect.
Awesome. Okay, so I'm going to take a quick look at what you have going on underneath.
Would you like me to take the mask off?
Yeah, go ahead and pull your mask off for a second, and you can keep it covered up over your nose and your mouth, and I'll do certain areas at a time. Do you want to tell me what you feel like you want worked on? What bothers you the most?
Honestly,
Everything?
Yeah, it was kind of a little bit of everything.
Okay.
I wasn't really sure if there was a process to this or whatnot, so I just kind of did like half of the face, so there was options.
Okay, so you're interested in having every hair on your face removed except for your eyelashes and eyebrows?
Yes.
Okay, perfect. So yeah, we can do all of that. The only thing I can't work on is the inside of your nostrils and the inside of your ear canals. Outside of that, we can do everything else, okay? And basically what we'll do is, I'm gonna do a short session with you today to show you kind of what it feels like, and to test your hair to see what modalities I'm gonna use. And then we'll talk about like doing sections at a time, so that, I know we're all wearing masks right now, but there might come a time that we're not. So a lot of stuff is covered up, but what we'll do is we'll plan, and I'll say, hey, look, I'm gonna start down here. I'll clear everything on your neck first, so that it's not kind of patchy. Depending on time, sometimes we don't have density of your hair, sometimes we don't have time to do all of it, but we'll try to make it a plan so that it's not like crazy for you, okay? You could even start off by, I'll say, hey, I'm gonna work on your neck first, so go ahead and let that grow out. You can shave everything else in the meantime, and then I'll give you a warning before we start, 2-week warning before we start the other areas, so that aesthetically it's not anything that's going to be weird, okay? If you don't mind and you don't care what it looks like, we can do whatever. You know what I mean? But we can always make plans so that it's not odd, okay? Depending on what you like, okay? So I'm just gonna take a quick look at,
And feel free to take off the ceramic mat.
okay, perfect. Usually what we do when we work with numbing cream is we'll pull it off and then put it back on until we get to that area because it keeps it nice and moist and it helps it to work, okay? You might find after you redo this that you don't need it. Some people are just like, I don't need it
I do a
anymore.
very high pain tolerance, so this is just kind of like a precaution.
Awesome, okay. Okay, so you're pretty fair skinned, right? Your hair is really not that thick. Okay, I'm just gonna make a couple notes on your file.
It's actually the first time I've heard that.
You'd be surprised what we see. Well, I might change my mind when I put my magnifying glasses on. I'm just kidding. Okay, so we're basically gonna do your whole face, right? Sensitivity-wise, you think that you have a high pain tolerance. Is there any kind of product or anything that you use on your face that irritates you at all? Have you found anything that you've been sensitive to?
I mean, I do get a pretty nasty razor burn sometimes,
Okay.
but it's like it doesn't feel uncomfortable. It's just like it
Yeah.
just gets red and
The cool thing about electrolysis is no more razor burn. It's gonna go away, okay? And since you're so fair, one thing that's really cool about fair skin and dark hair is that once we do remove the hair and kill the hair follicle, that dark pigment that shows up underneath your skin, that's hair, right? Once that's gone, your hair, your face, your skin will heal up and it'll be nice and smooth and you won't even see that dark pigment underneath there anymore. So it really makes your skin look really nice after we do remove the hair.
that's one of the major reasons why I'm
Yeah.
going this route.
A lot of people do it because of razor burn and ingrown hairs. They just can't handle it. It's not about aesthetics for them. They just don't want to deal with it, and that's okay too. This will fix all of that. Okay.
Okay.
Okay, and then skin-wise, do you feel like I think your skin's pretty normal. Do you feel like you're oily or dry in any places on your face at all?
No, I think it's pretty.
Yeah, you
Pretty
look like
normal.
you have normal secretion. It doesn't look like anything crazy. You don't look like you have any kind of acne.
A little bit of acne that pops up every now and
Yeah.
then, but it's it's
Mostly just irritation. It looks like razor burn
Yeah.
is what it looks like. And that comes after you shave, obviously, right? Okay. Do you go out in the sun very often?
not that often.
Okay.
When I do, I burn very easily.
That was my next question.
Yep.
Okay.
I used to get hives too, so that was fun.
Yeah, I'm the same way. The sun literally hurts me, so I stay out of the sun as much as possible. So I wouldn't say, maybe not highly, but very sun sensitive. Type 2?
Yeah, type 2 is probably
Okay.
closest because I do eventually tan if I'm out for long enough.
Yeah.
After the burn piece.
Gotcha. That's me too. Type 2. Okay. Okay, and then as far as your hair is concerned too, it's dense, but it's not overly dense. Obviously you've seen worse. You have just medium-sized hair. It's nothing that's crazy. The density is what's going to cause us to take a little bit more time. And the reason why I say that is because obviously there's more hairs. You know, if you had 10 hairs in an area or you had 100 hairs in an area, it's going to take a little bit longer to treat. But we should see good results. So a little bit dense. As time goes by and we do work on you, it'll obviously thin out. I would say that usually at about the 3-month mark, and I don't mean 3 months of coming every day. I would say, let's say we have you come once a week for the first 3 months. You'll see a huge dramatic difference. You can kind of see at the 3-month mark what's growing back in because that hair cycle is 3 months. You can see the texture will change, how the hair, the density of the hair will change. So about the 3-month mark. You just got to be patient at the very beginning, especially with dense hair, because it's going to be some time. And depending on what your sensitivity level is, how long you can stand it for. If you can only do, face is kind of sensitive to people sometimes. We have people that come in and do 3-hour leg sessions, no big deal. Some people come in and do 3-hour face sessions, no big deal. But some people can only handle an hour. okay? And that's okay. Everybody's different. There's nothing wrong with that. You just have to say, book me for only an hour. I don't want anything more than that. You know, obviously, if we have a little bit more time, we can get some more hair. But, you know, the typical face session is about an hour. Okay, now as we move down the road and we get to that 3-month mark, we might say to you, your skin's looking great, you're really thinning out. We only need to see you every 2 weeks now. Okay. So that changes how much you're gonna come in, because the density of your hair and how much is growing back, obviously, and how quickly it's growing has changed. We want to get you to the point after a year and a half where basically you're in maintenance mode. And what that means is you come in and you go, I got 3 hairs, you know, one right here, one here, right here. And, you know, we basically just check, and it's maintenance to keep it. Because, you know, even you might not grow a hair in an area for a year, and then all of a sudden your body decides, hey, we're gonna make a hair right here. It's gonna come out, you know what I mean? Because all it takes is that one cell left in there. Yeah. And that cell will regenerate. It just depends on how quickly it does regenerate. But with this method, this is, you know, the only FDA approved permanent hair removal method. A lot of them are semi-permanent, or could be permanent for some time, and then the hair regenerates and comes back, sometimes worse. It just depends on the person and what type of, you know, laser they received or hair removal they received. Okay. This won't cause it to come back worse. It only causes it to come back less. Okay. If you pluck, then it'll cause it to come back worse. Okay. That's a guarantee. Okay. So I don't really see any black. You're mostly dark brown.
It does tend to, once it grows out a little bit, it's very red. So I'm not sure.
Most men's beards are red. They do have a red tint to them as it grows out. Who knows? It's just a thing. Typically, red hair tends to be a little bit more difficult to treat because men's beards are hormonal hair. That's why I think they swing towards that red as it starts to grow out. But we'll hit them hopefully before it gets to that point. You know, it's not red, right? But yeah, most men do have red. I don't see anything else. Okay, can you switch sides for me really fast? Okay. Pardon my light in my eyes.
I didn't put any.
That's okay. Yeah, you do have some red guys in there. Yeah, but mostly just looks like a little bit of irritation with your razor burn, and again, that will go away. You know, I would suggest to really commit to the process. If you could stop shaving, you know, you can trim if you feel like they're too long with scissors, but to rub that razor on your skin, we get better results if you don't do that. Especially once we start the process of electrolysis, you know, you might see some reaction on your skin. That's normal, okay? You might see a little bit of a raised bump. Depending on your sensitivity level to it, it could last 2 days, it could last 30 minutes and then go away. I'm going to tell you what to do to make it easier on yourself, okay? Yeah. But if you never want to shave close to an electrolysis session. And what I mean by that is even at least wait 2 days afterwards, but I recommend not shaving. Try to trim it, okay? It'll make it easier on your skin. When your skin is irritated like this from shaving, it just causes more sensitivity and more opportunity for infection because it's open. Does that make sense?
Yep.
Before you leave every session, I'm going to treat your skin with some of our products that's going to calm and cool your skin and shrink your pores down, right? And I'm also going to use what's called cataphoresis, and it's basically a current that's going to push the product into your skin. And then it's a germicidal too, so it takes away any kind of bacteria, and then also closes up the follicle so that it calms it, okay? And then I'm going to tell you, you know, a million things not to do after you get done with electrolysis. Don't go in the sun, don't jump in the sauna, don't work out and sweat a lot, you know, no chemical products on your face as far as, you know, makeup or even sunscreen. Sometimes we have sunscreen we'll give you in case you need to go outside in the sun. And also the hardest thing for everybody is don't touch it, because you have so much bacteria on your skin, or on your hands, I'm sorry. When you touch your skin, Because everyone's go, oh, look how good it feels. It's nice and soft, but then you're pushing all that bacteria into your skin, and you don't want to do that.
Got it.
Okay, I'll go over all that with you at the end too. But we do that treatment for you every time before you leave to calm the skin down and make it a little bit more comfortable for you. Okay. Okay. Do you have any questions for me about any of that? Anything I went over? Anything you're worried about?
No, not this time.
Nothing at all? Okay, and then let me just finish up with looking at the middle section right here. Yeah, I won't be able to do this yet. We'll get there once we calm down with COVID cases everywhere, right? I could go as far up to here. I just need to keep this area closed up. But the chin area does tend to be very, very stubborn, okay? They're usually deep-rooted hairs. They hang on for dear life. They don't want to leave you. Anything that's close, remember, to the middle of your body is going to be like that. So in order for us to get good results, we might need to do a little bit more power in that area, but we'll do the least amount that we can. Okay? All right. Good. Okay, so what I'm going to do right now is I'm going to go grab a probe.
Okay.
You ready?
Yep.
Okay. I'm going to grab a probe, and I'm going to do test a few hairs on you. I'm going to change my modalities a little bit to see what works best. I would say before your next session, try to grow out just a little bit more.
Okay.
I can, as long as I can grab it with a tweezer, I'm okay. It's a little bit short, but try to let it come out just a little bit more. Not too long, because then it's all wacky and I can't get to it, but just a little bit more so that we can get that out. Maybe 1 or 2 days growth more next time, depending on how fast it goes.
Sounds good.
Okay. As far as you're concerned, do you think that you, as far as your schedule is concerned, can you commit to coming in once a week for a couple months? Okay.
At this time, I should be able to.
Perfect.
There might be some things that happen where suddenly I have to move
That's fine.
across the country or something, but barring that, yes.
Okay, we just don't want you to go too long between each session so that we can catch the hair in the right growth stage, and then also monitor how quickly it's growing and how your skin is reacting to it. So at the most 2 weeks at the beginning, okay?
No problem.
All right, and then, obviously if things come up, depending on your schedule and how you can figure it out, just do the best you can. You'll get the best results that way. The clients that we have that come consistently, especially at the beginning, have the best results. And if, depending on your sensitivity level and your schedule, if you want to come a couple times a week, you can. We can work on different areas as the other area is healing. And if you want to go a little bit faster, we're still going to have to go through the hair cycles because we can't speed those up. That's just biology and that doesn't change. But we could clear, what we call clear an area quicker the more time that we have. Okay. Clearing basically means I'm going to get every hair that I can see right now in this area, and then the next time that you come in, I'm going to check that area to see what's grown back and how your skin reacted to it. Okay?
Sounds good.
And then in between time, if you have any concerns about your skin or anything like that, don't hesitate to call, and we can help you, walk you through if you need to change what we give you for aftercare or something along those lines. We're very careful with the face, obviously. It's what everybody looks at. We want to make sure that we don't put any kind of damage or anything like that on it, but you do need, your part is just as important as my part is taking care of it after you leave. Okay?
Sounds good.
Good. Okay, so I'm going to grab a probe. And I may change probes, just bear with me because I want to get what's best for you right now. In the meantime, you can sit back here